it turned me on. I had some really good mentors in graduate school, and it turned me on to a world of thinking about disease a little bit differently in terms of nutrition. And I really would like to pick your brain today for our audience about thyroid disease, and I'd like to start maybe first with low thyroid, hypothyroidism, and just kind of have you walk me through that. You'd mentioned earlier that what you ran on your father was more than just the standard TSH. So maybe we can just start with like what is the appropriate investigation biochemically for somebody watching this to ask their doctor, hey, I want to do more than TSH. What are we looking at?
Well, the thyroid gland sits here in the lower part of the neck, and it's a small gland, a butterfly-shaped gland that produces a hormone, thyroid hormone, that's essential for every cell in the human body. We can't live without it, and it has to produce enough thyroid hormone to drive the metabolic rate of every cell in the body 24/7, 365 days of the year. So little variations in that thyroid hormone, it only produces about a teaspoon of thyroid hormone for a whole year. So little variations in that teaspoon have big effects on the body since every cell requires it. In medical school, I was taught appropriately thyroid physiology and biochemistry, that the thyroid gland is stimulated from thyroid stimulating hormone, or TSH, which comes from the gland in the pituitary, which is right behind here. And TSH is thyroid stimulating hormone, and it's named appropriately. It stimulates the thyroid gland to make thyroid hormone, which goes through the bloodstream and stimulates the metabolic rate of the cells of the body. So I was taught to check TSH levels only. And if the TSH level was above the reference range, they could have a low thyroid situation because the pituitary is producing a lot of thyroid. It's trying to whip the thyroid to make thyroid hormone, yet something's wrong here. It's not making enough thyroid hormone. So in those cases, I was taught to give them thyroid hormone, primarily Synthroid or levothyroxine or T4 derivatives of thyroid hormone. Well, I wasn't taught to do anything differently in today's world, because I just have two daughters who finished their training, and they were taught the same thing. The only thing different with them is they were taught to check a T4 level. T4 refers to a substance called levothyroxine, which the four is four atoms of iodine are attached to the thyroglobulin molecule. That's primarily what gets released from the thyroid gland and goes to the rest of the body, gets taken up by the cells, and then, drives the metabolic rate or does whatever thyroid hormone is supposed to do for those cells. So T4, when it gets invited into the cells, converts into T3, which is triiodothyronine, the active form of thyroid hormone. It has three atoms of iodine on it versus T4, which has four. That three-atom thyroglobulin molecule, T3, binds the thyroid receptors in the cells, and that's what ultimately drives the rate. So when I learned to look at the biochemistry a little bit in more detail, I was looking at thyroid hormone producing T4 and T4 converting into T3. I thought, why shouldn't we be checking that instead of just TSH levels? And after reading that book by Dr. Wright, I started to read other people's articles and books. And there were back then, that was early 1990s. So there weren't that many, but there were a few talking about we should be checking the other thyroid hormones. Why not check the active form of thyroid hormone, T3? And what if somebody has a conversion block? They can't convert T4 to T3. It's called a T4 conversion block. What if they can convert T4 to T3, yet there's resistance in the receptors of thyroid hormones to binding T3? It's called thyroid hormone resistance. If you're not checking this stuff, it doesn't exist. You'll never see it. What you don't check, what you don't look for, you're not going to see. So I started doing that full thyroid panel, which was a TSH level, free T4, free T3, a reverse T3, which is really important. I talk about all this in my book on thyroid and thyroid antibodies. And instead of checking one thing, I now check six or seven things. And I get a much better, broader, more important, more, just more what's going on in that person at that time picture than just checking a TSH level. What I found over 30 years of doing this is just checking a TSH level is it's a lousy way. It's not the word I want right now, but it's a lousy way to assess thyroid function, and you miss a lot of problems with it. And a lot of people are suffering because of that. So again, I have chapters on each of these things, in my thyroid book.
So just checking more in detail, you mentioned free T3, free T4, T3, T4, TSH, and reverse T3 as part of that spectrum of what you're measuring versus the standard TSH by itself. Um, you mentioned iodine. Do you measure iodine? Do you look at people's iodine levels as well?
I do measure iodine. That is part of everyone should have their iodine levels assessed. So iodine is an element that's an essential element for the human body. We can't manufacture iodine. We have to get it from the diet or we supplement with it. And recall that I said that T4 has 4 atoms of iodine attached to thyroglobulin. T3 has 3 atoms attached to thyroglobulin. You can't make thyroid hormone without iodine. Well, you can't make any hormone in the body without iodine because iodine concentrates in all the glandular tissues. The glandular tissues include the thyroid, the ovaries, the uterus, the breast, the prostate, and the pancreas. Um, and all these organs are producing hormones, and they all need iodine to do that. And they also need iodine to have the normal architecture of the glandular tissue. So if we have enough iodine, we have normal architecture. What does that mean? It means it's normal. It's a normal butterfly shaped thyroid gland. It has no lumps on it. It has no nodules. It has no cysts. It has no bumps on it. That means breast tissue is normal. No lumps, no cysts, no nodules, no abnormal growths that are growing. Pancreas, ovaries, uterus, all the other tissues would be normal. And if I call this normal architecture, that's what we want. And iodine deficiency, what's been shown in animal, test tube, and human studies is that you get abnormal growths in these tissues. If they take the form of cysts first, cysts are fluid-filled sacs. They're usually benign. But in the breast, fibrocystic breast disease, which is one of the most common diagnoses you can make for young women out there, is a precursor to breast cancer in many studies. But you get cysts forming in tissues, goes on longer, the cysts become hard and nodular, goes on longer, they take a hyperplastic appearance if you biopsy them and look at it under a microscope. And cancer is the end of that road. This has been shown in animal test tube and human studies. In animal test tube and human studies, you can halt and even reverse this pathway. Now, if you think about what's happening in our country right now, thyroid cancer is the fastest growing cancer. Breast cancer is a U.S. woman has a 1 in 7 lifetime risk of being diagnosed with breast cancer. Those are big numbers. 1 in 7 women. 1 in 3 men, similarly, prostate cancer. You have pancreatic cancer growing at epidemic rates, ovarian cancer, uterine cancer, same thing. And we have a big, big mess in our hands. And I think that mess is caused in part, probably in large part, from this iodine deficiency epidemic we're facing. I have a book on iodine called Iodine, Why You Need It, Why You Can't Live Without It. Iodine levels have fallen 50% across the United States over the last 50 years. And during that time, all those illnesses have skyrocketed. And, we're in trouble. And, this Maha movement is coming at the right time because America's sick right now. We need to make it healthy again. And it's going to come from a holistic approach. It's not going to come from a drug approach.
So iodine, for clarity's sake, because this question comes up a lot, so many people say I'm allergic to iodine. And in my experience, they generally have been exposed to some type of radioactive iodine. They had a negative reaction to probably more than anything the radioactive material versus the actual iodine itself. But could you comment to that?
So an allergy to iodine is an essential item. Every single cell in the body needs and requires iodine. So as you said, people can have an allergy to radioactive iodine dye that's given to them for CAT scans and things like that, medical procedures. That's common. And what's not common is an allergy to inorganic non-radioactive iodine. I can't tell you how many people that tell me they have an iodine allergy. Yet when I give them inorganic non-radioactive iodine that the human body has receptors for, whoever designed us to get iodine, to take iodine in because there's receptors all over the body for iodine. And very, very few people cannot tolerate taking inorganic non-radioactive iodine. such as what I described in my book, as a supplement.